I would like to call Miss Nehar Shrivastava to present the paper about to see the effect of autogenic relaxation therapy and self-management training and depression among adolescents, a comparative study.
Yeah, thank you so much, Ms. Jojo. Can I share my
Hi.
screen? Can I
Yes,
share my
go ahead,
screen?
please.
Yeah, just yeah. You all are able to see my screen?
Waiting.
Okay, just
All
wait.
right, it's up. Please have it on presentation mode and proceed.
Yeah, just a wait. Yeah, is it visible to all? So, hello everyone. Myself, Dr. Nihashi Srivastava, and I'm Assistant Professor, Amity Institute of Behavioral and Allied Sciences, Amity University, Rajasthan, Jaipur, India. And today I'm going to present my presentation on the behalf of Dr. Neeta Gupta, Associate Professor, DAV PG College, Dehradun, India. And now I'm going to present my presentation on the topic of to see the effect, to see the effect of autogenic relaxation training and self-management training on depression among adolescents, a comparative study. So this is my brief bio, and I'm Dr. Nihershi, and I'm the gold medalist of Lucknow University, India, and I have a distinguished academic record and hold a doctorate in psychology from HNB Garhwal Central University, Srinagar, India. And this is the abstract of my presentation. Uh, the present study has tried to explore the effect of depression in relation to group therapies like autogenic relaxation training and the self-management training among male and female adolescents. For this, different schools in Lucknow City, India were contacted and the respondents were selected using quota sampling. A total number of 200 respondents were selected through quota sampling from different schools of Lucknow City. They were equally divided into male and the female adolescents. They were further divided randomly into equal groups having different types of group therapy. Beck depression inventory constructed by Beck et al. 1961 was used to measure depression of the adolescents. A 2 by 2 by 2 factorial mix design was utilized to conceptualize the study and analyze the obtained data. After data collected, obtained data of pre-test and the post-test of autogenic relaxation training and the self-management training were analyzed by using SPSS. The obtained data were analyzed using mean, SD, and ANOVAs. The result have suggested that SMT was found to be a better technique for reducing depression among adolescents, and the female were found to report more depression than the males. So, as we all are aware about the depression, because COVID-19 pandemic has created a lot of depressive situations around the world. So, depression is a mental health disorders that can affect the way you eat and sleep, and the way you feel about yourself, and the way you think about things. It is not a sign of personal weaknesses, and it can be willed or wished away. So relaxation is a very useful technique, and it can help to relieve the symptom of depression, stress, and the anxiety. When we talk about the autogenic relaxation training, so this relaxation training first introduced by German psychiatrist Schultz in 1932, and first the training is encouraged to settle into a comfortable position, sitting upright, recliner, or the lying down. It's totally up to you. And what is the most important is that the chosen posture promotes calm relaxation. So the therapists begin by using verbal cues to guide the trainees breathing and direct attention to certain parts of the trainee's body. So when we talk about the adolescents, so adolescents need more attention. Why I'm choosing this particular sample? Because adolescents need more attention, more tolerance, more support, and more guidance to move smoothly with social context and practices. So these adolescents are an active part of the society, prove them, answer the new horizon of happiness and the relationship. So the present studies an attempt to manage depression among adolescents through self-management and the autogenic relaxation training. So our research objectives are to explore depression in relation to group therapies like autogenic relaxation training and the SMT among male and female adolescents, to explore gender differences on depression among adolescence, and to explore interaction of group therapy, ART and SMT, condition pre and the post, and the gender male and female, and all the dimensions of depression among male and female adolescents. And hypotheses are the respondents with autogenic relaxation training and the self-management training will differ significantly from each other on depression. And second hypothesis is there will be a significant gender differences on depression among male and female adolescents. Third, where there will be a significant difference in pre-test and the post-test condition of both the therapies on depression among male and female adolescents. And fourth is there will be a significant interaction between gender and therapy on depression. So these are my research design. A 2 by 2 by 2 factorial a mixed design was utilized to conceptualize the study and analyze the obtained data. So three classificatory variables were used to classify the respondents into 8 categories. The first category is variable being group therapy, which was divided into two types. First is a autogenic relaxation training and the second is a self-management training were matched on two conditions of therapy like pre and the post. So these are the second classificatory variable, and the third classificatory variable corresponding to the sex of the respondents led to the two categories of gender, male and the female. So as you all are see my screen, this is my research design. And this is my sample and sampling technique. The purpose of the present study was to see the impact of ART and the SMT on depression among adolescents. So for this, different schools in Lucknow city, India were contacted and the respondents were selected using quota sampling. So a total number of 200 respondents were selected through quota sampling from different school of Lucknow city, UP, India. They were equally divided into male and the female categories. So they were further divided randomly into equal groups having different types of group therapy. So that the sample scheme is you all are see on my screen. So tools was used as I have already discussed about the Beck depression inventory constructed by Beck was used to measure depression of the adolescents, and the therapy used is autogenic relaxation training and the self-management training. See, when we talk about the self-management training, so self-management training is a systematic intervention approach for evoking change in depressive adolescents. So it is based on the principle of motivational psychology and designed to produce rapid and internally motivated change. So hence the self-management training which is used in present study is some experiential and motivational learning selected along with the process using in psychotherapy. So these practices direct a person in the path of happiness, compassion, change negative thoughts into positive, thinking, which help a person to cope with depressive and suicidal kind of ideation, and improve positive coping skills. So there are many self-management techniques in tradition which could play an important role to make life better and which may have therapeutic effects. So this self-management training is the process of realization about the qualities of individual which differentiate him from others. So self-management training given by the self-management training manual, which is produced by Dr. Neeta Gupta and Dr. Nihushi 2018. And this manual consists various experiential and they motivational kind of activities. For example, self-awareness is also a part of activity in this manual, effective communication, motivation, and there are a number of games which is right from the transactional analysis. So game section based on the simple ice-breaking activities, and games maintain the same enthusiasm in entire therapeutic process. So using self-management support in primary care can have a positive effect on the care and health outcome of adolescents with depressive and suicidal ideation or suicidal kind of tendencies, and improve positive coping strategies. So after that, after data collection, obtained data of pre-test and the post-test of ART and SMT were analyzed by using SPSS, and obtained data were analyzed using means, SD, and ANOVAs. So this is the description part A, mean and SD on depression among orphans. As this table reveals the score of mean and SD for depression across gender, male and female, and the condition pre and the post test, and the therapy, autogenic relaxation training, and the self-management training among male and female adolescents. So it's autogenic relaxation training for pre and post test condition work respectively, as it shows my on my screen. So this shows that the mean score of depression after self-management training was found to be less than autogenic relaxation training. So it is also clear the inspection of this table from the post-test mean of the male and female were respectively, and this shows that the mean of females were greater than the males. And now this is the summary of ANOVA on depression. So this table result of analysis of variance for depression across all the three variables under study. So main effect of condition, the main effect of gender, and the main effect of therapy was found to be significant at 0.01 level, and the interaction effect of condition pre and post and gender male and female on depression was found to be significant at 0.01 level, while the interaction effect of gender, male and female, and therapy, ART and SMT was found to be insignificant. So combined interaction effect of condition, pre and post test, gender, male and female, and the therapy, ART and SMT was also found to be insignificant on depression. On the basis of these table, we can say that depression, when we talk about the first hypothesis, our first hypothesis was the respondent with ART and SMT will differ significantly from each other on depression. So when we talk about the first hypothesis, so it is clear that the result that self-management training was found to be more effective than autogenic relaxation training, even in reducing depression. So reason may be contributed to the fact that a key skill in self-management is self-regulation, and self-regulation refers to individuals monitoring, controlling, and directive aspects of their learning for themselves. So best use of self-management support is the collaborative interaction between the therapist and the client. So motivating, listening, and coaching are important self-management support skills that can make the therapist-client interaction stronger, and in which all members of the care team can become knowledgeable. So outgoing training and practice support clients in self-care will become part of day-to-day care. So SMT is effective. Self-management training is effective for building greater self-awareness and the self-acceptance, changing unsatisfying pattern and the behavior, motivating, and developing the necessary skills to face life challenges. So this training also has to live in the present moment and open true nature, as you all are know about that nothing is permanent and everything is changed from time to time. So self-management training to help enhance their this kind of thought. So and as it is a well known that the self-management training is a kind of experiential and motivational learning. So these practices direct a person in the path of happiness, compassion, and they change negative thoughts into positive thinking, which help a person to cope, move effectively with depression. On the basis of this, SMT is the process of realizing that every individual possesses unique qualities which differentiate from others. So SMT is found much effective because by this training, the change are found in cognitive level. Also, while in ART, the change of cognitive level are not found. So these are the conclusion. SMT was found to be more effective than ART in reducing depression among the respondents. When we talk about the hypothesis number 2 of the present study, was there will be a significant gender difference on depression among male and the female orphans. So when we talk about the second hypothesis on the basis of the gender, so maybe the reason may be attributed to the fact that females still have second position in society, and the situation become acute with females because they feel more helpless than males, so they cannot change anything. They are unable to express their emotions, which make them feel more anxious and depressed as compared to males. So this and the third is a post condition of both the therapies ART and SMT were found to be more effective to reduce the level of depression. So these results suggest that the intervention is significantly affecting the depression among male and female adolescents, because before the intervention the respondents were having a more depression, but after the depression it reduced a lot, because these results of the prison study was supported a number of studies which has previously done by a number of psychologists, and they have suggested that exercise and increased physical and the motivational and the life skills activity improves function, quality of life, strength, endurance, and reduce depression. And the second last is no significant interaction between gender and therapy were found on depression, and the last one is depression was reported less among males than females in post condition of both the therapies ART and the SMT. So this is the conclusion and the contribution of my study among the society. So very important contribution of the study is that is not only try to see the effectiveness of group therapies, but is also compare the effectiveness of two very important and useful group therapies like ART, autogenic relaxation training, and the self-management training dealing with depression. So finding have suggested that SMT was found to be more effective intervention training as compared to autogenic relaxation training as very effective technique in reducing depression and enhancing coping strategies. But the finding of the present study have suggested that the combination of different therapies can even lead to better intervention. So reason may be attributed to the versatility of SMT, because in this module we have include a lot of activities, a lot of different kind of activities in our manual of which is related to self-management training, and it compares many techniques which need active participation by the respondents, generating more interest and motivation among them, so they don't need any external push to deal with their problems. So this is my presentation. Thank you all. All the best for the best. Thank you so much.
Thank you so much. Anyone, do you have any questions or feedback?